Hi everybody, Elizabeth Statlander, marriage and family therapist and mental health counselor. So how do you get your medical marijuana card for post-traumatic stress disorder? Well, I can help you, and here's how I can help you. If you want to get your medical marijuana card for extreme anxiety that is stemming from PTSD, post-traumatic stress disorder, you have to have a clinician, a mental health clinician, diagnose you with PTSD, post-traumatic stress disorder. You can't just walk into a doctor who's certifying people for a medical marijuana card and say, hi, I'm here and I have PTSD and I want my medical marijuana card. You have to have that diagnosis. So a lot of people over the years, they lose contact with their therapist, or their therapist moves away and they don't have their phone numbers and they can't find them, and they don't know what to do or how to find their records, or maybe their diagnosis is expired because it was 5 years ago, and most certifying physicians want you to be diagnosed within 1 to 2 years. So come see me, because I can sit down with you and conduct an evaluation to determine whether or not you do have post-traumatic stress disorder. And if after careful observation and evaluation, I find that you do, then you can use that diagnosis to go and get yourself certified by a certifying physician. The other thing that I can offer with medical marijuana is that maybe you are thinking about using medical marijuana, but you're not exactly sure if it's the right thing for you. Well, you can come and schedule one session with me. It's a one-time fee. You can come and schedule a session with me just to consult and talk about it, and talk about your different options, why medical marijuana may or may not be the right thing for you and for what you're experiencing, again, with symptoms of PTSD, of course. So, I really think that medical marijuana has been so helpful to so many of my clients who have had post-traumatic stress disorder, that I want to let everybody know that I am definitely a mental health clinician that is open-minded to it, and that you can come and talk to me and not feel pressured to do it, but just come and talk about it. I also want to make it very clear that when we health professionals are backing and supporting the idea of medical marijuana for the 21 qualifying conditions, etc., we are not condoning or encouraging people to go out and get stoned all day. That is an unfortunate stigma that has become actually very upsetting, and to all of us who take it very seriously. And until you go through the process, you won't understand. But what we are encouraging people to do is, at least in the mental health field, and so I can only speak what I'm qualified to speak about, but in the mental health field, instead of putting people on rounds of antidepressants that don't work for them, because they don't work for a lot of people, or they make them feel worse, or giving them addictive types of tranquilizers that are very difficult to get off of, we now have another option that is safe and natural. And it's not about getting stoned all day. It's about going to the dispensaries, talking to your therapist, which would be me, or whoever you go to, using medical marijuana in microdosing, meaning you take a little teeny tiny bit and you just use a little teeny tiny bit until you start to feel your symptoms dissipate. And that's all there is to it. It's once you're stoned and you're really high, it's no longer therapeutic anymore. So I encourage people to come in, talk to me. You don't have to live in misery. You don't have to live with insomnia and nightmares and flashbacks and panic attacks. There is hope out there. Just call me, and I'm very happy and honored to set up and schedule a meeting with you. You can email me, eliztherapist@gmail.com. You can inbox me on Facebook, Actuation Counseling, and Making Change Happen. And you can also look me up on my website, but it's easier to just eliztherapist, all one word, @gmail.com, or just write me on Facebook, and I'll get you scheduled right away, and we'll get you headed towards relief. If you have any questions, any comments, please contact me. And understand also that if you are interested in getting involved in medical marijuana, but you do not have post-traumatic stress disorder, but rather something that's more of a medical or physical biological condition, and you need to be looked at for any type of chronic pain condition or other medical condition, that I work as a team with Dr. Rob Fishman, and he's right in Monroeville, very centrally located. And he provides medical marijuana evaluation and education services. So if I am unable to help you, I can definitely make the referral over to him, and he can get you started and educated and evaluated and on your way to getting your card, medically speaking.